Dr. Isaac Bose. Dr. Isaac P. Bose from Wayanad, Kerala. He is the third generation of the homeopathy in Wayanad. He graduated in 2018, has completed a master's course at Adasong Academy in Mumbai. He is the president and founder of Syndicate of Homeopaths, a complete learning platform which conducts seminars and educational webinars from time to time. He'll tell us about the thyroid disorders and its homeopathic approach. So now Dr. Isaac will take over the session. Welcome, sir.
Thank you, Dr. Priyanka. Is my voice audible? Can you see the screen?
Yes, sir.
Okay. So good evening, everyone. And so myself, I'm Dr. Isaac Bose, and I did my master's course in Adasong Academy, and I'm practicing now in Kerala, in Wayanad. So I'm basically a third generation homeopath in my town, because my father is also homeopath and my grandfather is also homeopath, and thanks to my grandfather that I've been practicing this wonderful system. Okay, so without much delay, I'll move on with my topic. So our topic for today is thyroid disorders and homeopathic approach, and this is completely my own experience, and that experience it matters only a matter of only 3 years. Okay, so it's not much of an experience, but then whatever I acquired knowledge about the thyroid cases and thyroid approaches in homeopathy, I'll share it with you all. Okay, so why homeopathy for thyroid problems? So the one main reason is to avoid the lifelong intake of the modern medicine. So once you start the thyroid tablets in the allopathic system, so you need to take it in the lifelong. Only they taper it down or taper it up, right? So even though the hormone levels are maintained, the physical problems are still not resolved. So this is where homeopathy has a role in the thyroid issues, right? The fact is half of our own patients, like our previous patients also, they do not know that these modern medicines can be stopped once and for all. So take 10 persons in count, at least 8 persons are affected with the thyroid problems. So the way of practice in thyroid problems, this is only my experience. So within a span of 3 years or so, I've developed this experience on thyroid cases. So I'll just listen and get hold of whatever information I'm sharing with you. Okay. So within 3 years, I've seen more than 18 to 90 cases of thyroid disorders. Mainly hypothyroid cases are most common that you get in the clinics, and the goiter, the thyroiditis cases, or maybe the autoimmune thyroiditis also, it comes less common when you compare with the hypothyroid cases. So majority are mostly female patients, and males only 2% are coming to our clinics, out of which only 25% cases continually follow up with you. So in homeopathy, when you deal with thyroid cases, you need to continually, regularly check your thyroid levels, especially your TSH values. So only if you go for a continuous follow-up, you can give them a complete betterment or complete cure, right? So 75% will not give you continuous follow-up and leave you for various reasons. And out of 25% cases, 20% had become better with homeopathy, provided that they follow up continuously. So following up for thyroid, especially for hypothyroid disorders, is necessary. And in 5% of cases, I failed to find out the correct symptom. So it's my failure and not our system's failure. So I was not that skilled to find out those cases where they gave me continuous follow-up for up to 1 year, but then I couldn't find the correct symptom. I don't know where I went wrong. So 5% of cases have left me. And out of 25% of cases, 20 cases have become completely better with homeopathy. So the aim of this webinar is to create awareness and confidence among our homeopathic doctors that thyroid problems can be managed with homeopathy alone. To prove that thyroid patients can be medicine-free and even free from the homeopathic medicine also. So for taking into consideration, you take a span of 6 months of homeopathic treatment, and you can get rid of the allopathic tablets, which they're taking it daily, and also you can stop our medicines also as well. The only thing is you need to monitor them for more than 1 year. So the webinar highlights what we're going to discuss today is, so I think it's 8:45. So I'll try to finish it as soon as possible, right? So case discussions will be there. 3 cases will be discussed, and how to taper down the modern medicines. So you should also have a knowledge about that as well, right? And how to handle the follow-ups and how to manage the immediate spike of thyroid levels through homeopathy alone. Okay, so these are the topics we're going to cover within maybe like half an hour or more than that. I'll try to finish it as soon as possible. So we'll move on to the first case, right? So this patient, she's a 35-year-old female, and she was taking 50 mg before she started her thyroid disorder. When she initially started the thyroid problems, she was advised to take 50 mg, the thyroid modern medicine tablets, and then the doctor reduced it to 25. But then this medicine, the doctor said that you have to take it lifelong, and so she approached for the homeopathic system to find out if any solution is there. So the physical complaint that she was suffering was extremities. She was having a lot of swelling and joint pains, and apart from that, no other physical issues that she was suffering with. And the next is, as a person, I asked about desires and aversions and all. So she likes SAD a lot, maybe not that much, but then she likes it, and spices also she desires. And throughout the case, she was completely smiling. That was one observation that I got throughout the case. So the nature, I asked her how she reacts as a person. So even after asking several amount of questions, also she just would simply smile, and she would really will not give me a reply for the questions that I asked. She would simply smile at all the questions. So I asked her any stress, anything like that. So she said nothing. And emotionally, how are you? Do you get anger easily? Do you get sensitive easily, or anything of that sort? And she still didn't reply anything at all. And then she explained herself that she's a kind of introverted person, and she does not get along easily, and she usually keeps herself away from the crowd, or maybe in any gatherings as well. So she said that she doesn't like to talk always. Then I asked her why. So she again explains that she doesn't know how to talk to others. It's very confusing to talk to others. So this was the answer that I got from her. And then I asked about the particular fears that did she have any particular fears of that sort? And she said that she is really afraid to go to the hospital for a checkup. And on probing more into that fear, I couldn't get nothing much more than that, except a fear of going to the hospitals to do a blood test, maybe something like that. And she also had a fear of darkness. And apart from that, no other fears was expressed, or maybe even searched in her life space also. And during her childhood, her parents, so she was a Muslim lady. So her parents were really strict, and she had a lot of elder brothers who would not allow her to go outside the house, or maybe of anything of that reason. So parents were really strict, will not leave her anywhere else, and she will not participate in anything at school. So any activities, any cultural activities, or any gatherings or any functions in school, the parents do not allow, and moreover, she didn't like to participate in those functions as well. So both of them were there. The husband and the wife also was there. So I asked the husband to give a few information about her. So the husband said that since she had this thyroid problem and she was also getting a bit obese, so this husband insisted her to come for a morning walk, but she refused the attempt because she said that everyone will look at her when she goes for a morning walk. So I asked her why does she feel that way? She says that everyone will see that. So usually she's a person who doesn't go out of her house right from her childhood. So if she's going for a morning walk on every day morning, and she has a feeling that everyone is looking at her. And most of the conversation was done by husband. So after this, most of the information was given by the husband. So she does not speak much. So even during family functions, she tries to avoid everyone and be silent throughout the function. And this one I mentioned it earlier, the morning walk part. And then even she got a license for riding a scooter. But then she refused to ride that scooter because she had the feeling that what will the neighbor think of her when she would ride that scooter? And all of them will again be looking at her when she's riding a scooter. So this is ultimately what I got the information from a patient. So I think it's an easy case to crack because if you go for the analysis part, we have a lady who was a really introverted person, so confused that she does not know what to talk. and she doesn't want to be noticed, right? So she doesn't want to be on the spotlight, like everyone looking at her. And she avoids all the uncomfortable situation as well. So this is the maximum symptoms that I got from the patient. So when you put it directly into the repertory, you know which remedy would come up. So if anyone who's reading Dr. Shankaran's books or maybe following him religiously can get the hold of the medicine. So the rubric I took was mind, timidity, bashful, and fear, disease of, fear, dark of, mind, timidity, public, about appearing in, confusion of mind, talking, aggravation, mind, confusion of mind, conversation, aggravation. And I landed up the remedy, Silesia, which I confirmed further with Dr. Shankaran's books, The Soul of Remedies. And in the follow-up, okay, so follow-up is quite important for the thyroid patients. So on 2/12/2020, I asked her to drop her modern medicine, which is the Thyronorm 25, right? So I asked her to drop that. And I gave her silica 206 doses, which I asked her to take 3 days once. And after her stoppage of thyroid tablets, okay, so I asked her to do a test within 2 weeks. So 2 weeks, she ran a blood test and her thyroid level was within the limits, within the normal limits of 3.430, which is again normal. And after a month, so after that, I asked her to take the thyroid levels after a month and then come back to me. So then again, the thyroid levels were again normal, 3.110 within the limits, even without the help of the allopathic tablets. So, and after that, she was given, she was not coming, I think, no. After that, December, she came back to me on the next year, 2021, February, right? So 9/2/2021, she visited me and there was a slight increase in the TSH levels again. So this time I increased the potency to 1 dose. Then I asked her to follow me up back, maybe after 2 weeks or after a month. So again, after 2 weeks, I asked her to run a test again, and the thyroid again came back within the normal limits. And again, she went off again with another dose of silica 1, just 1 dose. And so I didn't hear from her for a while. And then she came after, I think after 3 or 4 months, I think so. She came back and her last visit was in 2022. And even without any homeopathic medicines, she just came to me for some gas trouble or some other troubles she came. Yeah, she came for some gas trouble. And I asked, she then did a test on her own and she came to me and still her thyroid was in normal limits, even without our homeopathic medicines also, and also even without the allopathic tablets as well. So she's presently free of medicines now. She's not currently taking any medicine. You let it be it homeopathic medicines or be it the allopathic tablets. She's free from medicines and she doesn't have to take any medicines lifelong. Okay. So I have about more than 20 plus cases where hypothyroid, most of the cases are hypothyroid cases where the TSH levels have shooted up and it has been controlled beautifully with only through homeopathy. And all of them have dropped the modern medicine as well. So I'm just showing a few cases for just for a better understanding. Okay. So this is the first case, right? So maybe we can have the doubts in the last session. If anything that you all have any doubts, please we'll do it towards the end. So this is the next case. We are moving on to the next case. So we have another female of 52-year-old, and she's been taking Thyronorm 75 mg for more than 7 years. So since 7 years she's been taking it, and she has already undergone a hysterectomy. She has body pain, weakness, and sleeplessness. So these are all her physical complaints. She's basically a teacher. Okay, she's a teacher and she's been teaching for more than 10 years, I guess. So her main problem was, I asked her what is affecting you on the main problem. Her main problem, she exclaimed that she had tremors when she's doing her duty in front of the officers. So she being a teacher, so suppose if any authority persons coming to her, and if she's signing a letter or maybe something in front of a senior officer, she get really tremulous. She trembles while doing that, and she has to take tablets and go before that. So she being a teacher, she has to go to the other schools for being an external invigilator. So on going to another school also, she has to take some tablets to control this trembling. So otherwise, she could not perform in front of the officers. Perform in the sense she cannot maybe explain problems or maybe explain what is happening. But whatever is it, in front of the officers, she get really trembled about that. In front of the children, she's fine. So when she's teaching something in front of the children, she's okay, she's all good. But then in front of any authority or any in front of any teachers, she's completely fine. And she's really tensed on being observed by the officers and fear that she'll make a mistake when doing that. So of anything of that sort. And any particular fears, she has a stage fear, obviously, when presenting anything, and she has a fear while talking to the opposite sex. So even her childhood, she was brought up in a strict childhood. So she was very shy to talk to others, and due to her strict grandmother. So her grandparents were really strict that they don't allow them to talk to even to the strangers or to even to the male friends during her college time. So ultimately, this is the case. The reason why I took this case because this is quite similar to a previous case, but then we'll see what happened further. Okay. So the analysis, so thyroid problem, and she's very tense while performing in front of the officers, very shy, and she's having a lot of stage fear. As simple as it is, right? There's no complications or acid of anything of that sort. So again, when we put that into the repertory, we take mind timidity, mind anxiety himself about, mind anticipation, ailments from aggravation, stage fright, and fear failure of, which is sufficient to cover the complete case. So with a lot of confidence, I gave silica. So I started with 200. She came to me on January 2022. I started with 200 photos, 3 days once. And so she was taking a 75 mg tablet along with our medication also. So I asked her to take it 1 day or 2 days alternately. So in such a way, you can cut down the modern medicine. And so she doesn't develop any withdrawal symptoms. So she again came on February 2022. So January I gave her silica 200, and she came back to me on February 2022, and her TSH was normal within the limits. And so again I gave her silica 200 again 4 doses. Now this time I asked her to take her thyroid tablets within 3 days or 4 days gap. So naturally, when you have the thyroid levels in the normal limits, you can ask her to them to increase the amount of alternates. So in April, she came back. After February, March, she didn't come back to me. On April, she came back with the increased TSH. So again, you can find the TSH 5.5, which is more than the normal limit. So what I did was I increased the potency. Just like a previous case, I increased my potency to 1M, and I gave weekly once. And I asked her to maintain the modern medicine tablets as it is, like within 3 or 4 days. So again, she came back to me on May. On May, the very next month, she came back to me, and her TSH was again normal, 4.10 within the limits. So I asked her to stop her allopathic tablets completely, and I didn't give her any medicine at all. Since it was completely normal, I didn't give any medicine at all. Just SL was given for a month. And August 2022 again. So May, June, July, she didn't come to me. And August 2022, she again came back to me, and her levels was again normal. This is within the normal limits. This is 5.050 within the normals, within the normal limits. Okay. Right. So October, then after that, September, she didn't come for a follow-up. October, she again came back to me with the increased TSH, and this time it was increased more. So it was this time it was 8.310, which was more than the normal limits. So now I was wondering, like, whether silica was the perfect simillimum for her, because if it was, then she should have maintained the thyroid level within the normal limits. So what do we do? So the only thing to do is we need to do a retake. So again, we took the case. I sat for an hour and I took the case again, but I landed up with the same features of the previous analysis only. There's nothing to add on or nothing to remove also, the same thing. So now my analysis was, I was looking for a remedy which is more similar to silica. So I need a silica like a remedy, but which is not silica. So when you put it into the rubrics again, when you put it in the repertory again, so this time the rubrics were different. So I took anxiety, fear with confidence, want of self, feels inadequate, and restlessness, nervousness, anxious while, mind trembling with. So these rubrics I didn't take it for the previous analysis. So this time maybe I took a few refined rubrics comparing to the previous analysis. And mind timidity, public about appearing in top. So the very next remedy which came to my mind was Barretta card. And so in fact, if you read Barretta card, so we can see in Dr. Shankaran's books that another remedy which comes close to silica is Barretta card. So without any hesitation, I gave a Barretta card. So on October 2022, I gave a Barretta card 1M, 2 doses weekly once. Okay. And on November 2022, she came back with a normal report. So this was normal. So the picture is not clear over here. This is normal, 5.210, which is again normal. The reference range is 5.350. So again, I gave just 1 dose another month. And December, again, she came back and her TSH was again within the normal limits. It is again 5.250, which is again within the normal limits. After this, she didn't come back to me for January and February. So recently, which is like 2023 March, last month, she again came back without any medication. She was not taking any allopathic tablets. She was not taking any homeopathic tablets, homeopathic medicines as well. And she again came back with the normal report of 4.840, which is again normal within the limits. So free of medicines, in the sense she doesn't have to keep a lifelong medicine, which she was taking for 6 years. And free of medicines of any sort, be it our medicines or be it our allopathic tablets also, she's completely free of medicines. So the reason why I took this case, because this case was quite similar to a previous case, but then even though silica has helped her much, but then it was not the sublimum. So when you only give the correct sublimum, all the levels, the thyroid levels come within the normal. Otherwise, it will again show variations in between. Right? So I hope this case was clear. So the next case. So this will be the last case for us for our session today. So I'm just taking only just 3 cases just to show how to taper down the medicines and how to increase the potency, or maybe a change of remedy is required. Okay. So the very last case. So fortunately or unfortunately, all of the cases are female. So as I've mentioned it before itself, most of the thyroid complaints occur mostly to the female patients, and rarely any male patients have come to me. So this is a case of a female, 40-year-old female, and she's taking 25 mcg since 6 years. So all these patients have been taking medicine for more than 5 years, 5 to 6 or maybe to 7 years of that. So they take it daily. So other complaints she was suffering from recurrent tonsils, and she also had body pain, and she also had some hair loss as well. So usually I don't give much importance to the physical complaints, because maybe you won't land up in the correct choice of medicines. Maybe if you follow only the physical complaints, it's basically according to only my experience. Okay? So the observation throughout the case was she was smiling throughout the case. In the sense, you ask her something, she gives a reply with a smile. Okay. And the first thing that she explained about herself was, doctor, first of all, I'm not even regular with my thyroid tablets, which is a modern medicine, which is a allopathic tablets. She is not even regular with the thyroid tablets. So she's a Muslim. During a fasting season, she forgets to take it, and she also forgets to take it to her hometown. So when she shifts her town, she goes back to her mother's house also, or maybe to some other places as well. She forgets to take her medicines. So, and that is one time that she came to me, that she forgot to take her medicines, and it's been a month that she stopped taking the allopathic tablets. So at that time, she came to me with the increased TSH as well. So again, I asked her, how are you as a person? Tell me something about yourself. And she said that she likes to enjoy herself very much. She weeps easily, but only on seeing some sensitive scenes. She weeps easily. She is basically a tension-free person. Okay. So she likes to enjoy every moment of her life. So she likes to enjoy every function in my family. So any function in the family, she will be the first one to plan everything. She's such a jovial person that she comes in front of others, and she tries to plan everything, tries to get everyone to a gathering, and she tries to celebrate the festivals or functions or anything of that sort, be it a marriage function, be it their religious function also. She'll be the first one to initiate the plan, or maybe initiate to do the things accordingly. She likes to be stress free usually. The only area she gets tensed is anything about her family. So mainly her husband or her children. Any problem for herself, anything happening to her, she doesn't mind. But anything happening to her family or to her husband, to her children, she gets a bit sensitive, a bit tensed about it. But then not in a really bad way, but then she gets tensed about it. So her sadness is she doesn't like to, but nowadays she cannot do it like before. So before she used to involve herself in all kind of activities, and she used to arrange everything. She used to work for others and get things done. But then nowadays she cannot do it because after this thyroid has occurred, she's getting tired easily, and that is one sensitive area for her. So before, she was the first one to come up with anything. So any ideas, or let's do that, let's do this. So she's kind of what to say, she brings herself to the crowd, and they plan everything according to her. So these days these things are not happening, and she's really sad about it. So I asked more about her and any sensitive areas or any stressful situations, or nothing of that sort. So no other stressful areas or no other stressful situations in her life, and her dreams and her fears, nothing of that sort. So the question towards the end of the case, she asked me this question. So doctor, since I stopped my thyroid tablets, do I have to start again with it? So I was really curious about this question. So I asked her, why do you ask such a question? So she said that it's too difficult to take this lifelong tablets, because she needs to get up early in the morning. She needs to take it in an empty stomach, and she needs to carry it everywhere. She has to take it daily. So she feels that it's kind of a burden to take these medicines daily. So then I warned her about our medications as well. So you need to take it like thrice a week. You need to take it thrice daily. You need to take it twice daily. So then I asked her, what about our homemade tablets? So initially she smiled first, and then she said that it's difficult, but then I'll take it because I don't have to take the allopathic tablets lifelong, right? So I'll take it regularly for now, so that I can stop all the medication once and for all. For that reason, I'll take it. So that was the last part that she gave me. Okay. So I think that's all about her. I asked many things, her life situations, her childhood, and nothing that peculiar came up in the case. So that's all more about it. So when you go for the analysis part, we find a person. Okay, we find a person who's really careless. So we find a person who's really careless about taking her medications. So the doctor's advising her to take her medicines daily, but then she's too really careless about it, right? So that's the first part of her. So then I think the second thing is she likes to enjoy herself very much. So she likes to celebrate. She likes to enjoy herself very much. And now she's finding it really difficult to do anything due to this tiredness. She wants to celebrate. She wants to enjoy herself. She wants to be with her family, and she wants to be free. But then all these things are not occurring because she's finding it difficult these days due to her tiredness. She makes herself maximum free of burden. She wants everything simple as it is. She doesn't like to really make her like keep an alarm of taking all the medicines daily, and also that an empty stomach. So all these things she finds it as a burden for her. Okay, so this is ultimately the case in short. So when you put this into the repertory, so I took the rubrics: mind cheerfulness, mind excitement excitable, and mind imagine delusion poor he is, mind frivolous and careless, heedless and careless, mind libertinism. Okay, libertinism is a word where you have the meaning that they don't follow the authority, or they like to be free, liberty, right? And restrained, difficult to be. So she doesn't want to be tamed, or she doesn't want to give a string and do everything according to that. She wants to do everything in her own way. So mind restrained, difficult to be, and mind smiling. As I observed the case throughout, so she was smiling throughout, even while answering also she was smiling. So going to the follow-up part. So initially she came with a very high thyroid levels of 12.56. And this was when she stopped the allopathic tablets. When she stopped it for a month, she came to me directly, and it was 12.56 at that moment. So I started the Belladonna 200. So I gave it daily for 2 weeks, and within 2 weeks, her thyroid levels came back to 6. So 6.790 was the thyroid. So from 12, it came back down to 6 within 2 weeks. So the very next time, I didn't repeat the same potency. I tried to increase the potency as well. So I gave Belladonna 1 m, 2 doses weekly once, and within another 2 weeks, her levels came directly to the normal, even without any help of the allopathic tablets. So this is the very latest case, and this is on February 2023. I'm still waiting for a follow-up. So this is during the Lent season. So she's not. She said that she's coming back after the Lent season. So this is a very latest case for me, and that's how I manage my thyroid cases. And so just a quick in brief, what I do with my thyroid cases. So what I do is I actually borrow 6 months from the patient, focus on the why of the patient, why the shift to homeopathy, why they are planning to shift to homeopathy. That is one part I focus on. Like when you see in the last case, she wants to get rid of the medicines which she's taking daily. She feels it as a burden. So that is also one entry part. Maybe you can try to, when you're doing the case study. Focus on the stress of the patient. So all the 20 of the cases, I find that some of the stresses are happening, and that's how they land in the thyroid issues. So physical complaint can mislead you until of much importance. So the management can be of two types, maybe on track or out of track. So when you see the first case, the first silica case, it's on track. So we give the individual constitutional remedy. We ask them to taper down the modern medicines on alternate of 2, 3, or 4, 5 days, alternately in the increasing order. And if the patient stop modern medicines before treatment by themselves, well and good. Then you don't have to start it again. Okay, so you just have to give the Simlimum. Then if you're given the correct Simlimum, then there will be hardly any spike in TSH levels in your follow-up. If you're on track, monthly monitoring of the patient will be sufficient. You give them monthly test of the thyroid levels, then it will be sufficient. And if you're completely on track, even after 6 months, if their thyroid levels are on track, you can ask them to do it in an interval of 6 months, or maybe after 1 year as well. So this is when you're giving the correct remedy, when you're giving the correct Simlimum. So suppose if you're going out of track, like what happened in the second case. So you gave the correct remedy, maybe the similar remedy, and it acted only partially, right? So what to do then? So find out again the constitutional remedy. And so after giving the constitutional, suppose you came up with the remedy and you're giving it, and after 2 weeks, your TSH level shoots up. Okay, then you naturally come to a conclusion that you have not given a similar. So TSH levels again normal after 2 or 3 follow-ups, and that a slight increase, then you increase the potency of that medicine to find out whether it's working or not. So if it's working, well and good. So you again TSH levels again for many months it's normal. So when you see in the second case, we have a TSH level normal for more than 3 or 4 months, it's normal. Then again a sudden spike occurs. So you first try and increase and exhaust the potency. And if still the potency is not working, then you try and do a retake of the case and analyze according to the situation of the patient or any stress or anything of that sort. So do not hesitate to change the remedy. So even though you have given the correct remedy after proper analysis, do not hesitate to change it, because we may not be giving the correct remedy on the first time. So if no stress, understand the life situation of the patients and prescribe the thyroid specific remedies, which come on later, which come on an advanced level. So that I cannot share it because we are having a limited time. So maybe sometime later I'll share it. So if you're on track, for monthly follow-ups are necessary, and later 5 to 6 months follow-up will do. So will be sufficient. If you're out of track, I usually tell my thyroid patients to test your thyroid levels within 2 weeks, or maybe within a month, so that I can keep a track of their follow-up, and whether my remedy is acting it correctly or whether my remedy is acting wrong. So I can keep a check on it. So minimum 14 days is required to find out whether the remedy is acted or not. So how to do the TSH breakdown? So how to know whether you're going on the right track? So even 1 point increase in TSH level is also abnormal, and it's not a laboratory mistake. Okay. So even 1 point increase is also again abnormal in your levels and not a laboratory mistake. TSH levels should break down half or more than half in your follow-ups. So when you see the last case, the TSH was 12. So after giving the correct remedy, it got reduced to 6, right? So it should come below 6 or more than 6. I mean, more than the half of whatever value you're getting. This is only according to my experience. Okay, I've been treating for more than 3 years with a lot of thyroid patients. This is what I feel and what I got from my patients, the feedback from my patients. So suppose if the 14 was a TSH spike and the follow-up should be probably be its half, meaning 7, or it should go below, right? So 2 to 3 points breakdown in thyroid levels, it's not a good sign. Suppose if the TSH levels are 14, and if within 2 weeks you're going to do a test again, and the TSH level came down to 11, which is basically not a good sign because it should come below the half. Then maybe you're on the right track. Okay, this is only according to my experience. Things can vary. Okay, this is only for you all to be on a right track, to know whether you're on a right track. So that's all about thyroid approaches and homeopathy, and homeopathic approach in thyroid disorders. So I thank the Other Song Academy. So if at all I'm speaking about any thyroid disorders or anything, if at all I'm giving a webinar, it's only because of the master's program that I attended in the Other Song Academy. I thank my mentors and all the teachers who have taught me for being a better homeopath. Thank you. Thank you for giving me this opportunity as well.
So, thank you, sir. Thank you so much for sharing your experience in thyroid cases and how you approach homeopathically. And there are few questions mentioned in the chat box. Like Padmaja Ore, she asked how long she will be in a case, how long she will be free from thyroid, how long we need to observe to declare that hypothyroidism is cured. These results are only for few months, she's asking me.
No, if you see all these cases are more than 1 year. So 2020 they came to me, 2021 they are free of medicines, and 2022 they came to me, 2023 they are out of medicine. So it's more than 6 to 7 more follow-ups have been only those cases have been selected, and only the last case just because the medicine I just want to show the TSH breakdown, and that's why I showed the last case with the very few follow-ups. But the previous 2 cases was really old case. It was 2020. Another case was 2022. And all those patients have still they are still visiting me, and the thyroid levels are within normal limits. So basically, you ask them for 6 months. Within 6 months, you try to get them rid of the the allopathic tablets. Then you follow them up for more than another 6 months. Maybe after 1 year, you can ask them to check the thyroid levels every 6 months, whether the thyroid levels are normal, even without homeopathic medicines as well.
And one more person asked why to repeat remedy if thyroid levels is within the normal limits.
So these cases was back in 2020 and 2022 where I myself was trying to explore with some potencies. So nowadays I don't repeat the medicines often. So those are the previous cases. I wanted it to be genuine. So that's why I mentioned my potency changes as well. Nowadays I don't repeat that much. That time was my initial stages of my practice, and I was really, those are the very few times that I started practicing about thyroid disorders. Nowadays, I don't do it.
Yeah, and Dr. Arup Das, he's asking, should we have to take the only mental symptoms in thyroid cases?
I feel that since it's a hormonal issue, I feel that mental symptoms can be given more importance until and unless the physical symptom is that important. So mostly there's a lot of stress happening in thyroid disorders. So you basically identify that stress and prescribe accordingly, and then you find results according to my experience. Okay. So this is only I'm just into practice within a span of 3 years only. Okay. So it's only my experience. Anything wrong, and please.
Yeah. Dr. Sneha Balgani, she's asking, is there any chance of recurring back when she again gets any emotional stress in the case?
Maybe. So you can expect a variation. You can expect during menopause, or if it's a female, you can expect any variations during a pregnancy time, maybe during the puberty, or maybe during the menopause. You can expect. So during those times, you can give the specific remedies. Like when you go to the Fartek repertory, you can find menses suppressed activation, and goiter during puberty. We have hydrasis and calcarea iode. So those remedies can be used during at that time. I don't have such experience, but maybe you can try it out and let me know.
Yes, sir. So thank you, sir. If anybody is having any queries, you can please put it in the chat box so that we can be answered.
So the tapering of allopathic medicines can be done, as I said. So you suppose if they're taking 75 mg daily, you ask them to take it 1 day or 2 days alternately for 2 weeks, and you find out whether their TSH levels are within the normal limits within those 2 weeks. So if it's normal, then again you tell them to take it 3 or 4 days again alternately. So in such a way you can cut it down.
So one person is asking why 200 is frequently given, and
I think answer was already see 200. See, I'm a person who has a belief that medicine need to be repeated. It depends upon each one's perspective. Okay, so I believe that medicines need to be repeated in the before times, but nowadays I feel that only 1 m is more than enough. For nowadays I usually start with 1 m only for thyroid cases, because all the cases which I've started with 200 have gone up to 1 m. So I think nowadays I use only 1 m, and hardly in any cases I start with 200. And potency and repetition, it's mainly according to your opinion or your experience. So I'm still exploring about that.
yes.
And someone also asked about whether when TSH levels are more than 100. So in those cases, you need to check your anti-TPO levels, the TPO antibody levels. So that also will be increased. So those cases, you need to check that also as well. Try giving the constitutional remedy and see if that is also coming down.
Yeah, in cases of hypothyroidism, we don't need any intercurrent or nosode or sarcode. So that's the question from.
You need it because see, once I was attending, see, more than me, Dr. Gaurang Gaikwad has been dealing with a lot of thyroid cases. So I used to attend his webinars and his seminars. So during some cases, he used to give thyroidinum. So I mean, one case, I mean, someone has asked me about TSH levels more than 100. So there was a case where, if you see Dr. Gaurang Gaikwad, there's a case, and he has given thyroidinum 1 m, followed by the constitutional remedy, and which brought on TSH 100 to the normal within a month. So if you can try to contact Dr. Gaurang Gaikwad, or maybe watch his videos in YouTube, his case videos in YouTube, you'll find an answer for that. He has more experience than me in treating thyroid. It's actually, I learned from him how to treat thyroid disorders.
Yes. So Dr. Atit is asking, as you saw more than 70 to 80 cases of thyroid, any correlation with hysterectomy after? Family history of thyroid in multiple cases, any group of remedies for that?
Not particularly in hysterectomy, but then I can show you some rubrics where specific conditions are shown. Maybe, see, if you go to Fartic repertory and you type goiter, and you can see the different occurrences over here. So you can see during menses, so you can see 3 remedies given there, and you can see in menses suppressed from. So certain, then you can see in pregnancy during. Okay, so maybe you can give this medicines as an intercurrent while giving a constitutional remedy as well. So I didn't get any experience of that sort. That's why I have less to comment on that also. Maybe this repertory can help you with specific conditions, or maybe. I think I had a case on the first hand. I had a case where her menses was completely suppressed, and after that she had developed a thyroid complaint. So in that case, I gave ferrum iodatum. And her TSH was within the normal limits. So in spite of that also, you can give a constitutional remedy along with the such pathological condition remedies also as well. Maybe, I think so.
Yeah.
Is that it, doctor? Anything else?
Any diet for thyroid patient? Dr. Siddhant?
I think nowadays gluten-free diet. I think so. I'm not sure about that. Nowadays they say that take less of carbohydrates. I'm not much sure about that. I don't specifically give any. Suppose if they're taking a lot of leaf or vegetables, I tell them to maybe don't stop it, and all of a sudden maybe reduce it. Apart from that, I don't give any much advice.
Yeah.
So how to? Yes, tell me.
That's it. Somebody is Babu case is asking which repertory is more broader and updated with rubrics from new programs.
So I basically use complete repertory, and I think complete repertory is enough to practice, beat any case. And some cases decide the repertory also. So you need to change the repertory as well. Complete repertory will do, I think, so, most of the case.
Jay Surya is asking how to tap a allopathy medication.
So that you can take the screenshot of this.
Yes.
If you want. So I'll show you that. So you can take this. You can take a screenshot of this. So if already on modern medicine tapered on with alternate 2, maybe within 2 weeks, you tell them to stop taking it for alternate 2 days. Maybe if you're taking it today, don't take it tomorrow, and don't take it the day after tomorrow, and then you take it. So you're ultimately at the end of the day, you have to reduce the modern medicine, right? So you need to reduce the intake of the medicines. And when you reduce the intake of the medicines, the thyroid tablets, naturally your thyroid levels are going to increase. So you need to get that increased thyroid levels to normal with the help of our medicines. So that is the main criteria going. So within the normal limits, if they dropped it. So if you see the last case, they themselves dropped it. Then you don't have to start that again. Okay, because they're okay with they're dropping it. Then you don't have to start that again. So if they're already under for more than 6 or 7 years, so you do it step by step. Within 2 months, you take it 2 days or 3 days alternately. Within 3 months, then you taper it down to 4 days or 5 days. Irrespective of that, the thyroid levels should be in normal limits. So if it's not within normal limits, then you have to stop. Suppose if you first 2 weeks you've given 2 days or 3 days alternately, and you got a normal report, but within the next 2 weeks again the disease is increased. Then you stop with that 2 or 3 days alternately. That should be continued for a while till you get the normal report. So after that again, after TSH levels again coming back normal, then you go to 4 days or 5 days alternately. If that's clear.
Yes, sir. And Shanmukha Sri is asking how to know that how to take the case if there is no existing symptoms after few years of supplement thyroxine. Do we need to follow the first existed symptoms?
Come again the question.
How to take the case if there is no existing symptoms after few years of supplement thyroxine? Do we need to follow the first existed symptoms or present?
So I think what I understood is like where the symptoms are very few, right? I think. So in those cases, maybe you need to probe again. So see, not all the cases have been worked out for me. So I have cases where I failed miserably. I've treated them for more than a year and I still couldn't get their TSH under control, which is again my mistake, not the assistant's mistake, because my knowledge of skill or maybe that is quite below, or maybe I couldn't understand the patient as well. So you try your maximum to get maximum out of the patient, maybe the physical complaints or maybe the mental complaint as well. You try to get that peculiar symptoms or maybe those symptoms which are very clear. So if you see the last case, there wasn't any stress at all, right? But still the patient developed thyroid complaint. And what the reason for that is they don't want to be restricted to the medicines. So each perspective, I mean, each patient's view is different upon their complaint. Some of them, they say that they get fearful about the complications or maybe the side effects of the English tablets. And so they have come to homeopathy. So find out why they have come to us. So they have been taking English, the allopathic tablets for more than 7 to 10 years. And now they want to shift to homeopathy. So our first question is why? With that is we can crack the case.
Yes, sir. That's all the questions for both Dr. Carol and Dr.
Fine, we'll wind it up.
Thank you, sir. Thank you so much for sharing your valuable experience with us.
Okay.